I think from the patient standpoint, it's really the fact that you can do a better surgery. Two, typically your recovery is much, much better. I have two patients I always talk about. One, she was a runner. I did a hysterectomy on her 1 week. She walked the week after surgery, and she was running the next week. I have another patient who really is quite crazy. She had her surgery 1 week, and she comes back at her 2-week appointment, and she says, yes, everything's going well. I said, what did you do? She says, well, my husband and I had to cut down some trees over the weekend, and I used a chainsaw. I said, the first day was kind of uncomfortable, but the second day wasn't too bad. So, I mean, and I think the reality of robotics is that because you have smaller incisions, you have less pain. And the fact that when you do laparoscopic surgery classically, you're constantly moving instruments around and you're having to negotiate this angle and that angle. So what you're doing is you're putting a lot of stress and tension on the actual incisions that you've made. Typically help you have much less pain, and that's why patients enjoy it, because they can go back to work in 2 to 3 weeks and they will be okay. Many women who come in at 2 weeks are walking in just as if they've never had surgery, whereas in most cases with most surgery they're going to still have a fair amount of pain, and they're going to let you know about that. Now, not everyone, of course, is going to be that way, but the majority of patients really do come out of that surgery, do well. I mean, we send them home the same day now. And those who stay pretty much stay primarily because of a concern maybe of pain control, but in most cases don't really need any more than just oral meds anyway. But it's some degree, it's kind of a safety issue, a kind of a security. I'm in the hospital if anything happens. It's not so much, oh my God, I'm in so much discomfort, I need to stay in the hospital. So little things like that, better recovery, faster return to work, kind of the major kind of human benefits. And I think that when you get back to the surgery, it's just the fact that you're able to do a better surgery. And I really think that just allows you to have better outcomes. So you have less chances of them coming back to the hospital for other reasons.